Welcome back into Local News Live. I'm Camila Rueda. There are currently more than 5 million people in the United States living right now with dementia. Here joining us today is Dr. Mahnaz Rashti with MR Dental Aesthetics out of Beverly Hills. And Doctor, we are talking today about the link between your oral health and dementia. How are those two connected?
Hi, Camila. Thank you for having me again. The oral health actually is very directly related to your overall health. And there are so many bacteria that is in our mouth, like is over 700 different type of bacteria that exist in our mouth. And some of these bacteria obviously are good for you, and some of them are very harmful. These bacteria can, through your bloodstream, travel to your different organs of your body, such as your heart and your brain. And obviously, one of the side effects would be to have dementia or Alzheimer's.
Is connected to a lot more than, just your mouth. It affects a lot different parts of your body. So what else can bad oral health lead to if you don't take care of your mouth?
So there are so many research done and indicates that your gum disease or oral health, obviously from the beginning, a bad oral health with the bacteria that exists in your mouth. Some bacteria may cause cavities, and some bacteria may cause gum disease and gingivitis. This same bacteria may cause diabetes or heart attack, stroke, Alzheimer's, different type of cancers. So the management of your oral health is a very important aspect of your overall health. Like people who have diabetes, for example, there are much higher percentage of people with gum disease have diabetes. And people who have diabetes also, they have much higher risk, and there are more percentage of these people showing dementia, because remember, dementia is nothing except vascular disease, which is caused as a result of these bacteria.
This is very interesting. And how do we know that we're headed down the wrong path and we need to do something about it? I mean, it doesn't just happen overnight, right?
No, obviously not. In fact, CDC with the research shows that over 50% of people in America over age of 30, they have some sort of gum disease. And when they get older, like if you're 65 and older, this percentage increases to 70%. So oral health is very important. And there are indications that you know that you have gum disease. For example, if you have bleeding gum, let's say when you're brushing your teeth, your gum bleeds, or your teeth starts to shift, or they get loose, or you have bad breath, or you have difficulty chewing. Any of these could be an indication of having gum disease, and it's very important to see your periodontist and make sure that you see your dentist like every 3 months for detection of early sign of gum disease and, prevent the other associated medical disease that comes with it.
Okay, 50%. I mean, that number is huge. You see two people walking down the street, one of them has gum disease. So that's a big number there. If we think that we have gum disease, if you're brushing your teeth, your gums start bleeding, what do we do to stop it right there?
So number one, you want to make sure that you know about your family. There are people, gum disease unfortunately is hereditary. A lot of it runs in the family, is genetic. So if you hear that your parents or your grandparents were wearing dentures, you have to be very smart about it. Gum disease is treatable, but is not curable. Meaning that if you detect it early, you can treat it and you can maintain it by seeing your dentist every 3 months. But what is very important is early detection. Anything that can be detected early is much easier to treat it. Usually the one that is genetic, gum disease that is genetic and is not as a result of bad oral hygiene, it starts around age of 20. So when I see patients that they come to my office and they have gum disease, I ask them if they have children, and I definitely tell them, instruct them to make sure that their kids start to see a periodontist. early detection. Everything in the in health division is early detection.
That's right. And now explain to us one more time, how does bad oral care, like your oral health, how does that even lead to diseases like dementia? I mean, it's a little hard to understand, how it can start at your mouth, but really spread to your brain.
Okay, so remember, the pump is the heart, correct? And the same exact blood that comes to your mouth goes to your brain, goes to your other organs of the body. So if you have infection, oral infection, mouth is the richest area of the body with a lot of blood supply. So if you have any type of infection, the same every time you bite on something, every time you brush your teeth, every time you floss your teeth, and you cause any type of bleeding, the same exact bacteria that exists around in the plaque around your teeth will be traveling from your mouth to your heart and from your heart to all of your other organs. Some of the organs are very, very sensitive to this bacteria, such as heart. Any time that you have, for example, if you have heart murmur, your valves are not effective. So when this infected blood goes to your heart, it vegetates on your heart valve and causes heart valve failure. It causes, like number one killer for women is heart attack. And women with gum disease have 50% increased risk of heart attack. These are like extremely high. So the infected blood from the bacteria that is in your mouth travels to your heart and gets pumped directly to all of your organs. And that's one big thing that happens and causes all other organs to get infected.
Okay, so I mean, the connection is extremely high. And for people who don't think anything is wrong with them, why is it still so important to go see your dentist on a regular basis?
Camilla, one of the names that has been adopted to gum disease is called silent killer. Just because you don't have pain doesn't mean that you don't have the disease. And unfortunately, gum disease has absolutely no pain. I see people who come to my office and their teeth are literally falling out of their mouth, and they don't even know why their dentist referred them to my office. They said, I don't have any pain. So because you don't have pain, this does not indicate that you don't have gum disease. There are other indications: bleeding gum, bad breath, shifting teeth. If you see that you're starting to have space in between your teeth and you never had it before, that is an indication that you have bone loss. Bone loss happens as a result of the toxin that is produced by these bacteria. So even if you don't have pain, even if you don't show any sign of any symptom, please check with your dentist, specifically if you have a family history of gum disease in your family.
Okay, so go no matter what. I mean, silent killer, that really says it all. That's very scary to hear that. And now we know you're telling us that bad oral health can lead to these diseases, but what about good oral health, taking extra care of your teeth and your mouth? Can that prevent any diseases?
Absolutely, absolutely. If you have good oral hygiene, that means that you don't allow this bacteria that is in everybody's mouth to accumulate more and gets, reproduce and gets more and more. So every time that you brush, every time that you floss, you actually break their reproduction cycle and you prevent the accumulation of these bacteria and consequently being able to travel to the other organs of the body. So flossing at least once a day definitely is recommended after each meal, but if you don't have time, at least make sure you floss at night. Specifically at night is the best time. Make sure you brush at least a couple of times a day. I personally recommend to all of my patients to rinse their mouth also with warm water and salt, just very, very, very little salt in cup of water, and it will get rid of a lot of inflammation of the gum, and it helps for the healing as well.
Okay, wonderful. So if you do take care of your mouth, I mean, you see those benefits all throughout your health, your body, everything. Any other tips that you can give us to maintain that good oral health?
Yes, definitely. First, know about your family history. Two, make sure that you do visit your dentist every 3 months, regardless of like how good you think you are. That your dentist always find different locations that you could not find it, and make sure that they clean it. Three, please brush and floss. Give your children the habit, teach your children the habit of flossing from the early age, and warm water and salt again. And as far as like cavities, I see a lot of people that they have the habit of like sugar and candies. I don't have any problem with them, so long that you do brush or you rinse your mouth so you don't let these stick to your teeth and cause more damages.
Yep, so no candy before bed.
Well, you can have candy so long that you clean your teeth.
Okay.
There's no problem with it.
Sounds great. Thank you so much, Dr. Mahnaz Rashti, telling us about that link between your oral health and diseases like dementia. It's always good to brush up on those tips, and brush up, no pun intended there. All right, doctor, thank you so much for joining us here on Local News Live.
Absolutely. Thank you for having me, Camila.
All right.